So we're so excited to be here with all of you, and we're going to talk more about the amazing um, body part that is the ear. But so for background, we're from the Freedom Community Clinic, and by day, I am also a medical student. In my last year at UCSF School of Medicine, I'm the first in my family to become a doctor, so a lot of it is hella new. But it's also super interesting because when you get to learn about your body, when you get to learn about the different parts of your body that work together, um, and yeah, just the amazing things that keep you alive, even when you don't know it, it's super empowering. And the thing we do at the Freedom Community Clinic is we bring whole person healing that integrates the strengths of ancestral, indigenous, and holistic traditional healing with the strengths of Western medicine. And we specifically bring this healing to our communities, prioritizing Black, Brown, Indigenous, and undocumented communities. So you'll see Tiff and I basically on the streets, in the neighborhoods, in parks, at youth centers. And yeah, we're basically providing healing for the people in different ways. And I'm gonna let Tiffany Nareda introduce herself, but we do everything. So we do everything from blood pressure checks and people talking to nurses about wound care, about health education questions for diabetes and high blood pressure that oftentimes affects a lot of people of color. So we do that alongside, you'll see doctors and nurses working with acupuncturists and massage therapists and people who do more traditional indigenous energy cleansing. And it's really wild because for me, being in a hospital, you never see that. You never see doctors really working with people in the community in this way. And so we are just part of a long movement towards really making sure that both of them come together. And so I'm here to bring y'all the more Western medicine side, just learning more about the magic of the ear, things to look out for, and just some general tips. And then, yeah, Tiffany and Narita is going to talk more about, from a Chinese medicine perspective, how actually the ear is a little like microcosm, which is kind of like it can actually be directed towards healing different parts of the body. So the ear is actually super magical from an anatomy perspective. And there are a lot of different things in this different image. But one of the big things that I just want to show y'all is that there are actually three different parts. And the way that we actually hear sound is pretty amazing. So we actually have these sound waves, so basically the outer ear, which is kind of what you see on the daily, that's the outer ear. And then the middle ear, you kind of hear about, like, for example, earwax, or kind of like after you go swimming, you kind of get like water stuck in the ear. Usually that's within this canal, the ear canal. But basically what happens when you hear sound is that these sound waves, which are mostly air, basically, they travel through your ear canal. So from the outer ear to the middle ear, and they actually stimulate these different parts of your inner ear, which is actually more fluid filled, to actually vibrate. So in your middle ear, there are actually some hair follicles and some hair, they call them hair cells, that actually start vibrating. And that is what actually sends signal to your brain through these different nerves called the cochlear nerve and the vestibular nerve to actually allow you to hear sound. So it's pretty amazing that we're actually able to hear these different messages that get translated from the outside to the inside. And I'm not sure if y'all, when you go to the doctor's office, they like tell you to, like, they put the hand right here and they like ask you to follow the hand type thing. It's actually that one tests the nerve from your brain that controls your eyes. But then there are different other methods that your doctors use to assess your hearing. And so, yeah, you don't need to know these different parts. I would just know that, again, there are three different parts of the ear: the outer ear, the middle ear, the inner ear. And the one to just really pay attention to is that really affects, what we're hearing, and how that affects our health is this part, which is the ear canal. And I'm going to talk about two different things that I'm thinking about, which is one in terms of like earwax. Like, for example, you can't hear as well. Maybe it's in one ear versus another ear. Or if you feel like it hurts a lot, or if you hear ringing in your ears, a lot of that has to do with this ear canal. And that's because earwax can sometimes block it. But we should also acknowledge that earwax is also not bad. So you don't want a wax-free ear. You actually want some earwax, because earwax is actually helpful to protect the whole ear, especially the inner ear, from any from any infections, from any debris, from any foreign objects. You know, people put things in different places that we have no idea. So your earwax basically does that for you. It's actually super protective. And then the other thing is to just be aware that when you feel that blockage in your ear, of which sometimes maybe you can't hear from one ear, it's important to go to your doctor to see if that is basically earwax that's just kind of impacting your ear. And they'll be able to see it through an instrument called an otoscope, which feels actually really weird, but they just put it in your ear. And how do you get that out? For me, the best way is through your doctor. They have a really nice machine that can do that. But then also there are some over-the-counter medications that you can get at Walgreens or CVS that are basically oils that help to soften that earwax buildup. And I'm just going to stop sharing and just talk with y'all. But some other things that come to mind is that as young people, we listen to hella music. I personally love to boost up my volume and party and do all that stuff. And one of the biggest things that we've noticed and doctors have seen most recently is that a lot of young people are losing their hearing because of the volume that we're listening our music to and how often we're doing that. And so it's really just kind of like safety precautions and knowing yourself as to like, realizing, is my hearing changing? Am I not able to hear things? Are people saying I can't hear them? And realizing if that has to do with anything, whether you're like playing music too loud. The suggested volume is around like 60% on your headphones. But if you're always going to concerts, or if you're doing, well, not now, but like if you were going to concerts, if you were doing other things, that can really affect your hearing. And so there are different earplugs and just noise blockers that can help with that. And then other things that people don't tell you, that they don't know, is that a lot of medications can actually cause what is known as a ringing in the ear. So if y'all take, maybe you'll have headaches or have any pains and you take Advil or Tylenol, almost all medications actually have effects on your ear health that can cause what is known as, scientifically it's called tinnitus, but it's basically a ringing in your ear. And that's from a Western medicine perspective too. Sometimes ringing in your ear in other cultures can mean different things and have a more spiritual significance. But if it gets to the point where it's super bothersome and you're realizing like, ooh, this is not feeling right. Just something to think about is if you're taking any medications, really it's almost all medications actually have side effects on hearing, specifically the nerves. So that's one thing you can think about. If you had a recent head injury, that can definitely affect your hearing, but also other things like if anything with your thyroid, if you have high cholesterol, sometimes depression and anxiety can cause that ringing as well. And so that's just something to think about. And just to know that when you do go to your doctor, they will probably look into your ear to see if it's earwax. But the reality is that they will probably refer you to a special ear specialist who will do a more formal test for you. So it'll probably take see multiple doctors if there's something, if there are just any other issues. But I think those are pretty much it. Earwax is also, normal. It actually naturally just falls out. Again, it's really to help protect the debris. If you do ever find yourself um, having like a fever alongside an ear that's been constantly hurting, and you see any earwax that's maybe green or just a weird color, usually the colors are around like yellow and orange. But if you see any bloody ones or green or other colors, sometimes that may mean that there's an infection there and that you'll need to go to your doctor for some antibiotics that can help with that. And that's more common in like really young children. But yeah, sometimes with swimmer's ear, with the water in that canal that I was pointing out, that can cause some bacteria to just have fun there and cause infection. But then other than that, the ear is a very interesting, beautiful body part. And that's more from the Western medicine perspective, but we also know, but basically from Tiffany, I've learned a bit more about how the ear can also be super powerful in helping to relieve stress and anxiety, which I actually haven't learned about as a future doctor. So I'm actually super excited to hear more about what specific acupressure points can help relieve that. But that's from a Western medicine perspective from the doctor that I've learned about, and probably that your doctor's going to tell you.
I'm a traditional Chinese medicine practitioner and acupuncturist here in the Bay. I've been doing this work for some years now and been with Freedom Community Clinic for almost 2. And it's always a pleasure to introduce traditional Chinese medicine and acupuncture to people who've never had it before. Bernie mentioned the time that we were out and it was at a community event and they were playing Too Short, and that was really amazing because just bringing it to people where they're at is such a wonderful feeling. I wanted to share with you first an image, if you can see this. So this is the ear, and these are all the points that are on the ear. So the ear is actually a microcosm of the whole body. Yeah, it's a lot. And I'm not even sure that this is a comprehensive one either. Yeah. So in traditional Chinese medicine, there are many ways in which we can treat the whole body. We can treat it, at different spots on the body, obviously, but also if you've ever had hand reflexology or foot reflexology, those are also maps of the body. So the ear is no different. That's why there are so many points on it, because we're looking at your physical body and the emotional body, actually, which is what makes it so amazing and accessible for people. So we have a lot of points. And if you look at this image, it might be tough to see, but if you look at this image and you imagine an upside down fetus, and this being the head, and this being the spine, and then its little arms and legs up in here. And so right here, we have all the organs. And that's pretty much what the map looks like. So anything having to do with your head and face is going to be in your earlobe in here. There's actually a point on here that has been used in some clinics in China for tooth extraction. And they use it for the anesthesia. So there's some points on here. They put these little tabs in with needles and the person falls asleep and goes under. They extract the tooth and they're done. No medical anesthesia. So no one has done that here in the States yet. It's still illegal to do that, but it is possible. So if you have toothaches, so speaking of toothaches, if you have toothaches, then you can press in this part here, and that's going to help to deal with any like tooth pain you have, any jaw pain, anything that's really just like in your face is going to be in the lobe. Yes, so so these are body parts on here. So this being right here, this being that face again, and then going all up along the back of your ear, right in here. This corresponds, it has a lot to do with your back and and your spine, your shoulders. And then we get into the middle here of the ear, and that's going to be more of your internal organs. So your lungs and your heart, your liver is right on the edge back here, and your spleen, so helping with your digestion. And the point that Bernie had talked about dealing with stress and anxiety is up in here. So if you feel comfortable, you can touch your own ear. And if you go up at the top of your ear, like in this area, you might notice a dip. It's referred to as the triangular fossa. And in that dip, if you're going towards the back of your ear, so back in here, that's where the point is going to be for the stress and the anxiety. You can just press on it. You can press on it periodically throughout the day. You can press on it when you're, feeling super stressed or anxious, and take some breaths. You can press on it when you're having difficulty sleeping. It's helpful for that. If you're having difficulty sleeping, or if you tend to have a lot of anxious energy, you can take a little bit of lavender oil in a carrier oil like coconut oil or olive oil or jojoba oil. And you can put a little bit of that lavender in that spot right there, and it can help to calm your system because it's activating that point. So it was very interesting. And I also want to say thank you for what everyone shared about, their understanding of the ear outside of medicine. So whether that's cultural or, what sometimes they call like old wives' tales and folk tales and things like that, but they resonate. And what's interesting is that in traditional Chinese medicine, that ringing in the ear has two different meanings. So there's one when it's a sharp ringing, like a pinging almost, and that relates to the kidneys. So basically, it's like you're overworking. It's a sign that your body is overworking. You're depleting yourself. And when you hear that, what someone referred to as the ocean waves, which is just perfect because that's how we talk about it in school, that ocean wave has to do with the liver energy. And the liver is what is responsible for us maintaining a sense of calm. And it's what is overworking when we feel stressed. So I would be curious if you check in and when you're getting that ocean wave, whether you're feeling stressed in those moments. So those are just some traditional Chinese medicine correspondences with the sounds in the ear. Someone mentions, body modification in the ears. We talk a lot in traditional Chinese medicine about how someone who has fuller and bigger and longer earlobes is wiser and will live a longer life. So, which I definitely was like, oh no, I think I have tiny earlobes. But so there's a lot of significance around the health of your ear and the appearance of your ear, and just the healthiness of it. So those are definitely some of the points in there. The liver point for that stress is going to be towards the back. So if you find this, there's a hard piece of cartilage that goes through here, and if you just travel all the way towards the back of the ear, and that liver point is going to be back there. And you can press on that one. And that really helps with the stress. That's specific to stress. So some other popular ones. There is a 5-point, we call it a protocol of acupuncture that I tend to do if people have never had acupuncture before and they're not really sure, what it's about or what they would like to try it for, because it basically just helps the whole body reset itself. And those 2 points that I just mentioned are part of them. So one is calming the spirit, calming any anxiety, dealing with any insomnia, dealing with any stress. The other is specific to the stress. The other point is going to be if you feel down into the cave, basically at the bottom of your ear. So like in here, it's kind of hard to show on here. But if you go towards the canal of your ear and then come back, there's like a little basin, and you push down in there. That corresponds to the lungs. And so it's your physical lungs, and it's also the energetics of the lungs, which in traditional Chinese medicine have to do with grief and sadness. And these days, that's a really tender point on a lot of people. So that's also another point that you can massage, and that will help you to move through anything that you're holding on to. It can be helpful with depression as well. The grief and sadness is, in traditional Chinese medicine, we see that as one of the reasons for depression, that there is something there that we haven't, allowed to move through us. So there are some other tools that you can use. You just want to be very careful with them. There's one tool that has a rounded edge at the end of it. And, oh, that's beautiful. That's really, really beautiful. So yes. Okay. I love that. Thank you for sharing that. So you can, so on any acupressure point, you can use crystals and stones. Yes. And it will enhance the effects of it, just like using essential oils on different points, which enhance the effects of it. Or, tap into whatever it is that you're trying to do with those points. So yes, so you could choose rose quartz if you were pressing on the point for the heart, or, if you were just trying to bring that energy to whatever point you were pressing on, to bring that, loving energy, that heart energy. So you could definitely do that. And quartz, which is, a stone that's good for so many things. You can use other tools. I would caution against using a pencil, just because of the lead, and it is possible to pierce your ear accidentally if you're pressing too hard. And the ears don't always heal very fast, so you don't want to, cause any discomfort there, or break the skin there if you can avoid it. You could use a pencil, a retractable pen, when the tip is pulled in, in a pinch. There are these tools at the art supply stores, and I don't really know how to describe them, but they're skinny on both ends, and they have a little ball at the tips. You could use, anything that's gonna have that tip, but that's gonna be soft enough that you're not gonna break the skin. There was another question, but I'm gonna find it. To the lymphatic system. There is some debate about that. There's been a lot of debate about that. It is not directly connected to the lymphatic system, and that the points that were chosen in the channels were not chosen because of the lymphatic system. There is definitely some overlap. Recently, there was a study done that found there is a very thin sheath of tissue in the body that they actually believe is what is being activated with acupuncture. So there's still lots of debate about that, and lots of people doing studies around that to see whether that's actually true. But acupuncture and acupressure especially can be very helpful with moving lymph, for sure. Though not directly tied to it. The acupuncture is, in traditional Chinese medicine, are at least 3,000 years old, is, the general agreement on that. And the channels, the points, the methods, and everything are actually shared across various cultures. So in India, they were doing ear acupuncture, and in Mesoamerica, cupping was very popular, and throughout West Africa. They know that they were also doing cupping and possibly acupuncture. So it's a very old medicine that's shared through many, many, many cultures. Yeah, of course. Thank you for asking about the ear seeds. So ear seeds they serve as acupressure. And they're nice because they just stay in place. So you don't have to do anything. You would just press on the ear seed itself. And it's going to be either a little seed, which is a literal seed. The seed that is chosen is called the seed of life. And it's actually used in formulas to help bring down breast milk. So it has a lot of significance. And that's the seed that we use. And it's placed on the back of some tape. Sometimes it's clear tape. Sometimes it's, flesh tones. They're expanding what that looks like, because at one point it was only one tone. And it's placed on a point, whatever point is being used to facilitate healing in the body. And then you would press on it. You could press on it periodically throughout the day, or anytime you're having an episode of whatever it is. So let's say, for example, you had ankle pain, you got an ear seed on the spot for your ankle. Anytime you felt that ankle pain, you would press on it and then gently move your ankle around to facilitate energy movement, to facilitate healing. And they're safe. Sometimes it feels tender in that spot because it's being overactivated, and then you can just take it out and trash it. Yeah. And then the magnet, or what we sometimes refer to as a magnet, is not an actual magnet. You're not going to attract, paper clips or whatever else to yourself. It's a very, very low grade magnet, which just, again, helps to move the energy around the body. It looked like I had a question. Hold on, I'm going to try and get to it in the chat. Can it work for fractures? Yes. So yes, for the pain, yes, it can help. It can help manage the pain. I would hesitate to say that it's going to heal the fracture. It can, however, help with moving the energy around so that your body can heal the fracture. Sometimes what happens is that when we're healing from something, we don't move it, and it gets what we refer to as stagnant. So having ear seeds or doing acupressure on yourself or doing acupuncture just helps to keep that energy moving so that the body can heal. And you want to practice some more? Okay, so let's see. So here we have the shoulder. So if you're going from that bridge and you go all the way out, and now you're going to be on the outer part of the ear. And you want to press in there for a tender point. So some people have that fold like this. That's what this represents. There's like that tiny fold. So you want to go out to that fold and press right around here. And you're looking for a tender spot. So when you find what we refer to as the tender spot, so it's just going to feel a little bit different. It might be really painful, or the quality of the discomfort might feel just a little bit different than what it feels like on some other part of your ear. And that means that you found the right spot. Because as you all can see, there are many, many, many points on the ear, and our ears are not this large. So that pain is what tells us that we're where we need to be. You go ahead and you press on that, and then you gently move the shoulder around. If the ear that you're pressing on is the same side as the shoulder, then you want to try and reach across and do it. I would definitely say try both ears. Just like anything on our body, we feel things differently on either side. So if you're trying a point on one side and you're like, it doesn't really feel like it's doing anything for me, go ahead and try the other side, because you may have a different experience on the other side. Okay, so the wrist is going to be up here. So this, remember that triangular fossa we talked about earlier for the point, for the stress and anxiety and insomnia? You're going to move away from that one towards the back of your ear. And this one is going to be right before you get to that fold of skin, if you have that fold of skin. And again, you want to not be using the hand or arm that has the pain, because then you can't really move it around and see if it's helping. So you want to cross over if you have to. So this is like, if you have little people in your life, you know, children or yeah, mostly children, this is a really good way to help to get them to calm down. And it also works for us who are, you know, not little ones anymore. Okay, so you're going to massage your ear and really take your time with it. You can do both at the same time if you want, or you can do one at a time. I like to start at the tops of my ear. So it's like getting a whole body massage. And you just squeeze and pull just a little bit, and you squeeze and pull and squeeze and pull, and you go back, you know, you just go down this outer part here where that fold is. You go all the way down and take your time. You don't have to rush. And then spend some time at the lobes. This is like giving yourself a facial. Really pull your lobes, pull them back, pull them down. Glasses on. And then you want to go back up. And as you go back up, move your fingers in a little bit more so that you're getting more of your ear. And when you get up to the top up here, you want to go into this whole area here, this triangular fossa area. And just squeezing and pulling gently. And coming back down, massaging the cartilage. Until you get to the cave. It's right here. And then just going on the insides. And it's like giving your organs a massage, because this is where the bulk of the organs are, is right in this area here. And then just going all the way up. Until you get back to this area right in here. If you have someone who can do that for you, that's even better, because then you can just relax and someone else can massage your ears. You can use, like I mentioned before, with the lavender essential oil, but you can do it with anyone that feels good to you. If you want to wake yourself up, you can do it with, you know, an oil that wakes you up, peppermint or citrus. You could do it with frankincense if you want to relax, you know, whatever, really. And just a little bit of carrier oil and just massaging your ears. It works very similarly to foot massage and hand massage, because you're getting your whole body with that ear massage. So, yeah. And if you're feeling stressed, that's always something, you know, nice that you can do for yourself to just relax. So, yeah. Thank you all. Thank you for letting me share this with y'all.
Well, if there are no further questions, definitely feel free, if you are here and can turn on your cameras to say peace or give a holla over the mic, and thank FCC for coming through.
We're here. Take care. Much love.
Thank y'all.